Hey guys, welcome to the Health Babes podcast. Today we had on Dr. Connealy. She is amazing. She was one of the favorite interviews I've done. She talked about integrative oncology. We talked about detecting cancer early on, some of the underlying things that cause cancer, some alternative treatments to cancer, how she works with this in her practice. And it's just so much great information. She's the author of The Cancer Revolution, which is an amazing book that I recommend you check out. And we really hope you enjoy this episode. So let's start with talking about how you got into integrative oncology, because I'm really interested in this.
Right. So everyone has a journey, right? And they usually live their life, because of their journey. So I am number 3 of 6 children. I grew up in Texas, and my mother started bleeding. And of course, any mother is shocked. They don't want to lose their baby. And so she went to the doctor and they said, okay, we have this medication that will stop the bleeding and save your baby. So sure enough, my mother took the medicine, which was called DES, diethylstilbestrol. And that was the drug given in the 50s and for probably about 42 years, actually, to prevent miscarriage and stop bleeding. And so I'm 16 years old, and my parents receive a letter saying that that medicine caused cancer in both male and female offspring, hormone problems, anatomical problems, etc. So they said we need to go to a cancer hospital to get evaluated. So I lived in Houston, Texas. So I went to MD Anderson, which is one of the ivory towers of cancer. And so I started getting evaluated, since I was 16 years of age. And so that changed because I'd never really gone to the doctor. Here I am getting pap smears, biopsies, abnormal results, all kinds of things. Luckily, I grew up really natural. And so I grew up eating bone broth and sauerkraut and all those good things that people think is real fashionable today.
Yeah.
And so I never ate at fast foods. My mother, you guys might not even know this lady, Adele Davis. Do you know Adele Davis? Well, you ought to look her up because she was a very famous nutritionist during that time. So my mom had her all of her books, and so they're really good. And they talk about eating liver and all kinds of ways of getting healthy. Yes, so it'll be something to look up and read. And so luckily I grew up, I never had 2 periods in a row in my life, in my whole life. Okay. And so I decided though I wanted to go to medical school. So I prepared, I was really good in biology. And then I said, okay, I don't want to be in a lab doing Bunsen burner experiments. I want to be talking to people. So what could I do? So I babysat for this lady doctor. So I said, oh, I can be a doctor. And so I went to college. You have to make straight A's so you can get into medical school. And then after college, I went to UT School of Public Health and did my paper on DES and studied all the things on DES. And then I went to medical school, and then I went to Harvard General at UCLA in Torrance, California. And then I started my practice, and I met this gentleman who was an internist pathologist from Texas, even though my practice was in California. And he's like, oh no, you need to know a lot more things, a lot more pathology, a lot more this, a lot more that. And he opened my eyes to a lot of new things. I was like, whoa, I didn't even learn any of this, So anyway, that was 35 years ago. And so I started out my first practice with a registered dietitian, and she had a history of anorexia. And I'm like, how perfect is that? Because she gets the relationship of food, right? And she was completely recovered, amazing girl. And so anyway, I started my practice like that. We were so busy because we focused on how people live. They focused on the metabolism. We focused about hormones, things that people weren't even doing back then. And so anyway, so that's where it started. But my prevention, I am always like looking for like, how do I prevent cancer in me? Like, so I would go to this conference, that conference, everything. And so I met this gentleman at an anti-aging, they have this big anti-aging conference in Las Vegas. And I met this guy, and he had sarcoma. So sarcoma is a tumor of muscle and bone. And he's telling me his whole life story. He was diagnosed when he was 22 years of age. And the treatment for sarcoma is amputation or surgical removal. And he said, I refused that. And he said, I spent 11 years figuring out how to save my leg and cure myself of cancer. So I go, oh God, I need to know everything he knows. So he taught me everything, like so many things, copying enemas, energy work, Chinese herbs and, just everything. Okay. And so I was like, okay, I need to know. And then he designed his whole goal was to set up prevention clinics all over the United States to prevent cancer. So anyway, I learned everything, and then I started, learning it and doing it. And so then about, I don't know, 15 years ago, I met Francisco Contreras, and Francisco Contreras is the head of Oasis of Hope in Mexico. And they are, they started doing cancer, different treatments for cancer 50 plus years ago. So he said, oh my God, I finally met someone who I want to partner with in the United States, because they always wanted to duplicate Oasis of Hope in the US. So we started Oasis of Hope years ago. Well, of course, people only want to go to the United States. They don't want to go to Mexico. Right. So if there's a clinic, so we had to say, we need to just set up our clinic here, and he needs to do his clinic there. And so that's what we did, is we set up my clinic here. And I actually had an oncologist who I brought to Mexico to learn all about this, way of treating patients. And so anyway, that's how it was germinated, through that connection with Oasis of Hope. Now we're a standalone. We didn't call ourselves Oasis of Hope. We called it Cancer Center for Healing. And that's where we are today. And
the rest is history.
The rest is history. And now, as you guys know, cancer is 1 out of 2 people.
I know.
And over 1,700 people are dying a day. Nothing in oncology has changed in 35 years.
Yeah.
And if we're doing so good in medicine, why are you just seeing just an alarming rate? And what I've seen in the last 4 months, maybe 5 months, I have to kind of look at my calendar to see. Now I'm seeing all of these young people 40 and less.
Within the past 5 months, you've noticed that?
Yes, I've noticed it. And I'm like, whoa. I mean, my scribe, she keeps, track of our medical records when we see patients. She's only 25. She's applying to medical school, and she is shocked. Okay. She's like an objective person. All she does is, and she's like, oh, she just like she's like in disbelief. Her whole viewpoint of medicine has changed, because she used to work in cardiology. She worked in other medical offices, and she completely decided to completely get healthy since she's been working with me. At the beginning, she was like, whoa, this is kind of a little different. But, because when you see that, right? I mean, that's all you know. Okay. Yeah. And that's your comfort level. And then she's completely changed her whole way of looking at things. She's done cleanses. She does infrared sauna and red light here. I mean, she's like completely changed how she lives now.
Yeah.
But we are seeing, I mean, I cannot tell you, probably 60 to 75% of my new patients are less than 40 now.
Oh my goodness.
Wow.
So what this is saying is like, we have an emergency 911, and I'm not an alarmist. Okay.
Yeah.
Because
Yeah.
I've gone through lots of things in my personal life and my professional life, but this is the young people, like the babies, the children, the young adults are the canaries in the mines that there's something not right.
Right.
Okay. And then more importantly, what screening do young people have?
Right.
None.
Nothing.
Women get a pap smear,
Right.
but what about the rest of the body?
Right.
And then you don't want to alarm people. I don't like to alarm people. I'm just not that kind of person. Okay, here, this is what but I do think that we have to have a prevention paradigm now because of what I'm seeing. Because when a young person gets diagnosed, it's way more serious than a person 60 plus. Why? Because the DNA is replicating so fast and the margin of error, your proliferation indexes tends to be higher. So I just now I'm like thinking, I've been thinking and talking to my marketing team, like, okay, what do we do here, for these young people? Well, one, we create awareness, but I do think young people, what I'm really happy about is that young people are now like seeing this and they're trying to change and they need help with their generation guidance, like, okay, what do we do? How do we do it? All this kind of stuff. But I do see the young people today really like questioning and saying we need to be healthy, etc. And so we've got to, one, create the awareness. Number two, it's not that expensive to prevent cancer. It really isn't. Meaning, yes, lifestyle, you know what I'm saying? Obviously, you guys know lifestyle and nutrition are the cornerstone of all cancer prevention, all diseases for that matter. But I think we have to do a little bit more. I go, in the last 30 years, we've gone unchecked as a society.
Yeah.
Like, we brought all these new things and all this, new technology, new chemicals, new this, but it's all unchecked. And we're seeing this. Look, if autism is 1 in 37, why isn't there like a timeout?
Right.
Saying, come on, as a society. It was funny because my daughter just moved to Santa Monica. And so, we were sitting on the couch and her roommates were coming in and they're all young people. And this guy comes in and he is a young guy, like 32 from Missouri, and works for Anheuser-Busch. And we got to talking for some reason. I don't know how we got to talking about health. And he goes, how can everyone not see that everyone's unhealthy? He goes, I mean, this is a no-brainer. Now, this is not a guy in health. This is like, and you're like, okay, so we are seeing it, like, come on.
Yeah.
But, he's not in the health field. He is himself working on his own health. He was telling me he gets his hormones checked. And I was telling him, make sure, did you get your CRP checked? I was telling him these other things. He goes, okay, I'll do that next. And so I think that we just need to really, really make young people aware, because this is, yes.
We got to wake up.
We have to wake up, because health, if you don't have your health,
you don't
like, there is nothing. You don't have yourself. You can't have a relationship. You can't have your job. Your family is all influenced because they're all worried, concerned about you. And then they give you all these ideas. Okay, do this, do that, do that. And, like I said, conventional oncology has changed very little.
Yeah.
And very little in the last, 35 years. I mean, they have some immunotherapy, but if you look, actual life extension is not that long, right? And so, and I have young children, young adult children. So I am concerned, even though they all tend to, listen to me and follow me for the most part, not completely, because
we know how that goes.
There are distinct ideas. But if I take someone that's not my child, they tend to listen.
Oh yeah. Yeah. It's for all of us.
So anyway, so I appreciate you guys, really, doing what you're doing, because this is what has to happen.
Yeah. So what are some ways that we can identify cancer early on, and why is screening so important?
Right. Well, first of all, as I said earlier, there's no screening. Okay. So like, let's say you're a young 35-year-old woman. What is there?
Right.
There is the pap smear. Okay. Which I do think is important. But because a lot of women today have viral infections, and whether it's HPV or herpes or both in some situations. So when you have a virus, your immune system is weakened. So that means you've got to take proactive measures to keep those viruses in check. And so, pap smear is important, but what about all the rest of the body?
Right.
So I think that a real comprehensive blood test. So when I say comprehensive, most doctors do a chemistry panel, a chem panel, which includes your electrolytes, your kidney, and your liver. Okay, so that just makes sure. But I tell people that just makes sure you don't have an emergency. Then a CBC checks your white count, your hemoglobin, but young people, tend to have like normal blood tests. Okay, but that's really all they check.
Yeah.
So they don't check C-reactive protein, which is a non-specific marker for cancer. They don't check hemoglobin A1C, which is a reflection of your sugar over 90 days. They don't check vitamin D. Vitamin D influences 3,000 genes in your body, plays a role in almost all diseases. DHEA sulfate. DHEA sulfate is the hormone of your adrenal glands. Your adrenal glands sit on top of your kidneys like little hats, and DHEA is the primary hormone. There's 100 hormones made, but DHEA is one of the big ones, and that's your hormone of stress, immunity, and longevity. So I look at those. You got to make sure your thyroid's working, because the increase in thyroid is like 30% thyroid cancer. And then thyroid diseases like autoimmune, Hashimoto's, all that has increased. It's probably one of the fastest growing, is thyroid abnormalities due to toxicity and probably EMFs.
We work with a lot of Hashimoto's, and I have Hashimoto's. So we work with a lot of Hashimoto's patients.
Right, exactly. So you got to make sure your thyroid's working. You got to make sure you order the right panel, because a lot of doctors just check one or two things. No, you need to have the whole picture. And then I would like to also make sure that there's not a hormonal imbalance, because we have estrogen dominance, right? Yeah. And so, I mean, there's a lot you can do, but actually a comprehensive blood test costs about $250. Most of the time insurance pays for it. Okay. So most of the time, but with our lab, they give our patients it costs about $250. So it's not that expensive.
Yeah.
Then the other thing that I like to do that's not too expensive, which is what I learned 24 years ago, is something called the acupuncture meridian assessment. You have acupuncture points on your fingers and toes, and we have them all over our body. But when you look at the acupuncture point, we look at the energy going through. So I tell people an acupuncture point is like a string of pearls or a wire to an organ or gland. Energy precedes action. So we can look for energy imbalances, all right? So we can see the impedances of the system, because our body is a bioenergetic system. And a lot of people, poo-poo all this, but I tell people, if I send your cholesterol to 10 labs, how many different results am I going to get?
Right. Yeah.
10.
Different. Yeah.
Okay. So we can't, we have to like, hopefully we're getting a pretty good, reflection of your blood work. Okay. Then that's the biochemical part. So there's the biophysical, which you need to see patients, you need to examine patients. And since COVID, doctors have gotten away from the physical exam. So you can look at patients, whether it's their skin, the sclera of their eyes, their tongue, you examine them, you examine their lymph system. So if a good thorough physical exam can give the doctor lots of information, but because people do a lot of telephone and Zoom, you're missing that, physical exam, which I think is really important. And yes, I can do some Zoom and telephone once I've done that, but now we're really making our patients, we've always made our patients come in, but now we really have, because we see what you don't see on phone and Zoom. And when you see them in person, you're like, oh, whoa, this is interesting. Yeah. And then, like I said, the bioenergetics of the body. And that's what one of my mentors that I told you had sarcoma. And so he created this, so for cancer's a 10-year disease, right? So from one cancer cell to the tumor, like the time you feel it, or you get pain in your abdomen, or you get pain somewhere, and then you're like, okay, you go to the doctor, okay, I've had this pain, it's not going away. And then they start doing workups, right? So it takes about 10 years for it to physically manifest on a CT, PET, MRI, ultrasound, et cetera, right? So when I do this testing, it looks to see if there are some imbalances in your gastrointestinal system, the genitourinary system, the glandular system, et cetera. So I can detect early imbalances. Well, that test is only $250. Well, between your blood and that, I can tell a lot of things for very inexpensive.
Great. Yeah.
Yeah, now, we do that blood panel too, the exact blood panel you listed. It's all really important stuff.
Right. And then there is a blood test. I use a lab called RGCC. And RGCC is a blood test that will do something called the oncotrace. So the oncotrace tells me if you have circulating tumor cells. So circulating tumor cells typically come before the lump or bump. Because remember, I said cancer starts with one abnormal cell in the right conditions.
Right.
And it starts duplicating. And when it gets to a size of 1 to 2 millimeters, which is just 2 pencil lines, it starts releasing circulating tumor cells in most situations. Not every situation, but I would say most. So then this test tells you, it will definitively look at breast, prostate, sarcoma, renal, kidney, and sarcoma. The other ones, it'll tell me the cells, like epithelial cells or tumor stem cells. So it's a good screening. I think it's, I don't know. I know it's less than $1,000. So it's, somewhere between $750.
Sounds worth it. I mean, it sounds
like
an amazing
exactly.
test.
When you think about, okay, when you get diagnosed with cancer, now, if it's early on, you can, really turn that around with the patient. Mm-hmm. But, in a young person, you're healthy, so you don't feel things.
Right.
Okay. Like for example, yesterday, my first patient was 40 years old, super fit, super healthy guy. Okay. With his wife, they were adorable couple. And he felt a chest pain. And he knew he was actually doing a Zoom with a client. And he's like, you know what? Something's not right. I need to reschedule this meeting. And he goes to urgent care. Urgent care says, there's something wrong with your EKG. I need to send you to the ER. So they send him to the ER. They do EKG. They think it's his heart. Instead, though, it was really something else. So they ordered chest x-ray, CT scan, and then they found the mass in his lung. It was, yes. And it was B-cell lymphoma. Okay. Wow. So I'm like, and he went natural 8 years ago. He and his wife, 1000% natural. But what did he do? So I always like to go back since you were born, right? Because you are a bio immune emotional accumulation of all that.
Yeah.
Okay. So a couple of things. He grew up on very unhealthy food. He told me that when he ate pizza or carbohydrates, he would have the worst stomach ache. So he probably had a severe wheat problem, probably borderline, celiac, right?
Mhm.
Then he told me he took antibiotics for years and Accutane for his acne. So
Oh,
what did that do? Destroyed your gut, your
yeah.
microbiome. What do you grow with excessive use of antibiotics? Candida, right? And then even with Accutane, you can have serious irreversible bowel dysfunction. Okay.
And liver too, right?
Yeah,
With
it's very hard on the
Accutane.
liver.
Yeah.
Exactly. And so then I said, well, what kind of work did you do? He was a landscape
Oh, that's
engineer.
Oh.
So what did he do? Exposed to weed killer, right? Glyphosate. Anyway, so then he decided to get out of that and do what he's doing. But then I said, well, tell me about your family history. So his mom is super unhealthy, dad super unhealthy, and he has a brother that was schizophrenic, diagnosed when he was young. They're usually diagnosed about 20, give or take. And that was torture because he'd go in the bathroom and like scream and yell. And I mean, until they got him medicated properly. Anyway, so that was very traumatic, right?
Yeah.
So you put all this perfect storm together,
Mhm.
and that's what manifests illness, because illness doesn't happen in a terrain that is well cared for, taken care of, etc. And you put all these, pieces of the puzzle together, because you've got to unravel a person's life to understand why they're in this particular big situation, right? It's not like, okay, let's do some surgery, chemo, and radiation.
Right.
No, I mean, we have to understand the why, where, when, and how of any illness. It doesn't matter what the label is, right?
Yeah.
So it's fascinating. Luckily they understand everything, right? And they get it, and so they're naturally healthy. The wife is completely on board and everything. So, but once you get diagnosed, the amount of energy, emotion, trauma, just getting diagnosed,
I know.
much less what you've already lived with. So that's why I'm so passionate about people learning how to take charge, because I tell people now self-care is the new healthcare, because our medical system is very broken.
Yeah.
And our medical system is surgery or medications, and that's their options.
Yeah, no diet changes for the most part either.
No mental, emotional, psychological, spiritual changes, no dietary changes, no lifestyle changes, none of those. No, like, what are your nutritional deficiencies, etc.
Yeah.
So we are going to change the system, and we do it day by day, and we change it one person at a time. And we just got to make it more contagious.
Yeah.
And I do think that's happening, though. I
think it is too. I really do think it is too. We've been really diving into the emotional trauma, aspects, and with our patients, we will refer people to do like somatic trauma therapy and stuff like that to kind of move that energy out, or that trauma out that they've been holding their whole lives, in conjunction with what we're doing. Because we know we have a part, but there's other pieces to the puzzle that, we don't specialize in. So it's all really important. And it's important for us to shed light on some of those things too, like meditation and, just all the different lifestyle changes too, because those make a huge difference, as well as what, diet and all that stuff.
Yeah, it's everything. We are a biological system, and it starts from the head first,
It really does.
and then goes down. And one of the things, I didn't know anything about stress and emotion or anything when I mean, through schooling, that was never really talked about, really, even in psychiatry. Even when I did psychiatry, is here you have this diagnosis, here's this drug. And back then we used electroconvulsive therapy. I'll never forget. So that was really traumatic, because it was like, whoa, okay. I mean, it probably is beneficial in some patients, but it was really, that was like electrically shocking people. Was, I mean, it's scary, for someone young that, isn't quite familiar with that. But anyway, but that's what they did. They never talked about trauma. They never talked about stress. They never. And it wasn't until I was 45 that I started to learn about the biological effects of stress. And for the past 20 years now, I mean, I would tell you that is your number one thing we have to address.
Yeah, I agree.
And it's the hardest, I feel, for patients to tackle. Don't you feel that?
Yeah, because you can't be objective,
right,
about yourself, like not even me, okay? And even with what I know, you need an outside person to help navigate and unravel that.
Mm-hmm.
And then we need techniques that do it quicker than slower.
Yeah.
Because we need to get well and safely. Yeah. Yes, exactly. And we can't be doing things that, we don't have when you have cancer, you don't have the next 3 years of psychology you got to do things. So we've learned and studied and done all kinds of things. And I'm very, very familiar with all the different modalities and everything. So that's like the first thing I have patients is their eating and their emotion.
That's
because
great.
Your eating is the biological information to tell your cells what to do, right? And then the emotion is how you're programming yourself every day.
Mm-hmm.
And so we started the cancer conversation in January, and that is every Wednesday. So we talk about a topic. So last night was on stress. I'll send it to you guys.
Oh,
and it was all, it was all on stress.
Yes.
Yeah. So I'll send that to you guys, but our response has been unbelievable. People are just so interested. I mean, it's a different topic every Wednesday.
Mm-hmm.
And to understand like the basic foundational elements, the root causes, because, when you go to the doctor today, okay, here's your problem. Here's your imaging. Here's your biopsy. This is what you have. You need surgery. You need chemo, radiation. And okay, if you fit in that, great. And then, okay, we'll see you every 3 months. And then when they ask, my patients will ask, especially the young ones, they will ask their doctor, like, okay, well, how are we going to monitor? He goes, oh, when you get a symptom.
Gosh.
I'm like, when you get a symptom, it's going to be big.
Exactly.
Right.
But that's what they tell my patients. And they also tell my patients that what you eat doesn't matter at all.
Of course.
We hear it all the time. It's awful.
Yes, every single patient. I'm like, in 2022, how could you possibly be saying that? Like, it's in every magazine, even the non-medical, just regular magazines. Okay.
I know.
And so we're just, the patient is who's losing out. Okay. And because, what you eat is probably the single, probably greatest factor in your, health.
Yeah. And
so the patients, they're lost, they're discouraged, they don't know what to do. But a lot of them are now, they're reading, they're research, they're studying, they're scared. So it's prompting them to look at other, other possibilities.
Yeah.
And so it's, I think it's changing. It's just, this is a big ocean liner. Medicine's behind probably 20 years.
Mm-hmm.
And it's so broken. To fix it is monumental, right? And but it starts with, really, I believe it starts with your family unit.
Mm-hmm.
And so before a future mother tries to even have a baby, she should be 6 months getting healthy.
Mm-hmm.
Yep, we always say that. Yeah.
And the family needs, so the husband and wife, or whatever the situation is, you need to get healthy. and then have that proper intention with wanting to have a child. And then when you have that child, you need to create this beautiful environment of eating and the right everything, music and the right stimulation. And I mean, I've read so much because I had kids already. So I read everything, like what do I do as a mommy? I used to babysit, but okay, at 14, you don't know anything, right?
Yeah.
I mean, I did what I was taught, but we now know, like, and there's lots of mommies now who are creating those beautiful environments with their children, with the proper eating, the sleep, the order, the rhythm of their day, the right music, all these, little things that you can do to create this beautiful atmosphere of proper child rearing development. And so, because, when I was born, they just like, okay, you just go through the day. I mean, it was actually lots of good things because we played outside.
We're outside. Yeah.
We played outside. We slept outside. I mean, we did all those kinds of things.
It's so true.
Yeah.
Oh, I miss those days a little more, don't you? With all the screens and everything now.
Yeah. Now with the phone and the iPad, I mean, your child shouldn't even have any of that, because what it does is it stifles imagination and creativity in their own independent thinking. So
and their circadian rhythm.
Yeah. Well, and it's, electronics we are bioenergetic. I know a lot of people have a hard time with this concept because you can't see it, but I tell people an EKG is electrical system.
Mm-hmm.
An EEG of your brain is an electrical system. And we know that every one of our cells emanates a biophotonic light of energy. So we all are energy. And I always give the example, when you go hug somebody, that was an energy transfer.
Mm-hmm.
Right?
Mm-hmm.
I love that.
And so that's why touch is so important. And so people just have a hard time understanding the biological aspect of energy. So with all these, satellite towers and cell towers and phones and electronics, and I have to say there's a lot of beauty of it because we're able to do this conversation right now.
Right.
But at the same time, we have to make sure that we balance it, with grounding and protecting yourself at nighttime, with maybe turning off all electricity to your little area, which is what I do. But it's a real problem. Okay. It is a real problem. And there's a great book, I don't know if you guys have read, called Invisible Rainbow.
I've heard of it. Yeah.
Okay. So Invisible Rainbow was written by Arthur Furstenberg. And if you haven't read it, please read that book. He really has an amazing mission. And, but he chronicles illness with the invention of electricity.
Oh, gosh.
So anyway, so we, it's not going to probably go away anytime soon, but you can learn how to protect yourself.
Good.
Okay, every day. And that's, I think, what you have to learn how to do. And grounding and being with nature is a good way to do that. You can practice doing that on a regular basis.
Would you say that you're seeing, the rise with cancer with around 40 years old, probably due to a lot of the electromagnetic, fields and the just the products we're putting on our skin now, all the chemicals we're getting in, the environmental toxins, like, what the chemicals in our food. I mean, do you think that that's because it seems like that stuff's getting more and more. So do you think that's why the age you're seeing younger and younger?
Right. Well, I think it's a compilation of things, but I always kind of reflect daily on, okay, why are we seeing so much in young people? Because the young people, I can see in older people, but I can't see these young people 20 to 40. Okay.
Right.
It's crazy. It's a lot. Okay, you guys, it is alarming. Okay. Because my patients come from everywhere. It's not like just California or just, it's everywhere. So it's not like it's a geographical thing. But I would say stress is more prevalent in young people because you guys have constant stimulation of this and that, and all these things. Like I didn't have that. Okay.
Yeah.
I didn't have any of that. All right. And I didn't have that distraction. Okay. And then you hear news, and news, there's nothing like good about news. So that's stressful. And the news is not light, it's intense. It's like beyond unbelievable.
Yeah.
Okay. And then I think the diet, okay, you have all the glyphosate, Monsanto weed killer, that. And then it's not just that. Now they found nanoplastics in your blood. I don't know if you guys saw that study. So everyone's eating a credit card of plastics, but that started a long time ago.
Yeah.
The plastic problem. Then you talk about the pharma water. So if you don't drink purified water, you're drinking pharma and chemical water. So you're having to process that. I mean, how much can your body handle? Okay.
Right.
I tell people, we know what one chemical does, but we don't know the synergistic potential of all these chemicals.
Yeah.
And 50% of the population now has fatty liver.
Yeah.
1 out of 2 people have fatty liver. Why? Because they're taking in all this stuff. And then let's face it, people probably for the most part are not eating well.
Mm-hmm.
Okay. They're not mindful and conscious of what they're putting in their mouth. I think there are people that are, but I think there's a lot of people that aren't mindful and conscious of what they're eating. And so you need to use products that they have integrity, ethics, farmers markets. You've got to be, try to avoid all the plastics. You got to avoid the microwave to quickly warm up water or food. I mean, it takes a minute to buy a tea kettle and warm up water. It takes a couple of minutes to warm up your food and purified water. I mean, it's just not that big a deal.
Right.
And but really know the food you're eating, and you have to look at everything, every morsel of food as medicine, and it's biochemical information that is telling your cells to do good or bad. And then today, I don't know what you can do about EMFs during the day. You can wear, they have that clothing,
Mm-hmm.
that clothing. I personally take antioxidants every day, lots of C, and I take xanthan every day. So I do countermeasures, and but there's not a lot, unfortunately, to do other than a good eating and supplementation. Like I would say the vitamin C is, probably the easiest thing for young people to take every day.
Yeah.
But these EMFs, they're real. I don't care what anyone says. And everybody goes, oh, it's nothing. That's not true, because your cell phone insert even says it's carcinogenic. So, and there's
Denial.
yeah, it is real. It is a real problem. And like I've had girls, they used to wear the cell phone in their pocket. Okay. Well, now what they're seeing in young people, because they would carry it in their pocket or their back pocket, their increased risk in colorectal in 25-year-olds.
I have a friend who I went to high school with, and she put her cell phone in her front pocket, and she got cancer. And I didn't know her as an adult well enough to ask her the details. But it was like in her leg, like in her lymph nodes, like in that area. And she ended up dying. I mean, that's how severe it was. She went through chemo.
Old was she?
So I'm 43. So she was about 45.
Wow.
She would be now. So she died a couple of years ago. So yeah, I mean,
what kind of cancer was it?
I don't know. Cause I knew her in high school, and then I saw it on like Facebook and didn't want to really pry, but it was like me reading a story and going, I wonder what the details are, but not wanting to bother her with questions. And I know she ended up going through chemo, because I remember there was like pictures of her with no hair, and she, lived through it, but then she ultimately did end up dying. So I'm sure she relapsed.
Right. Yeah. But there's a lot. I saw a lady doctor, I forget her name. She gave a big lecture on this, and on the colorectal in young people.
Mm-hmm.
Okay. From EMFs. And then there was a neurosurgeon, and because I get info all the time on different things, and I'm always, reading everything. And so he's a neurosurgeon, So his wife got really sick. She's a physician. She got really sick. So he started like, okay, like how are we going to get her well and so forth. And, he's a conventional doctor trained, right. Then he started like researching and found that really her biggest problem was EMFs. And now that's all he does is talks about electromagnetic fields and how they affect you and everything, because he was personally affected.
Right. Of course. Yeah.
Yeah. And so, but a lot of people, lots of people are talking about this, and I always tell patients, look, because a lot of people go, oh, that's nonsense, da, da, da. And I go, look, hand washing, when Dr. Semmelweis recommended hand washing in the hospitals to decrease infections postpartum, that took 100 years.
Wow.
Hand washing, not gloves, hand washing.
That's crazy.
Cigarette smoking took 50 years.
Yeah.
You guys, we don't have this much time.
No.
We need to do things right now. Okay.
Yeah.
Scurvy took forever. I mean, I can give you over and over and over examples, but we don't have the luxury of time. We have so many people in dire suffering, and we are a community, and we thrive best when our community is healthy. And when you're not healthy, it affects me directly or indirectly some way. And so we as a nation need to be concerned about the health of every individual and actually commit to doing things correctly.
I agree.
Yeah.
Can you walk us through can you discuss a case in your practice for us?
Oh, I have so many cases. So many. Well, I talked to you about the lymphoma guy. He was a brand new patient. Okay. So interestingly enough, I have so many cases. They're just so fascinating. I would love one day for you guys. You can come and visit anytime.
I would love to.
We would
It's
love
just
that.
fascinating. And that's why I'm always very thankful for my job, because I have this privileged, beautiful, intimate relationship with these patients in a very difficult time.
Yeah.
And of course, I want to save every person, right? Because that's the way I'm a mother. And then I'm a doctor that, I got to, what if it was for me,
Right.
So, I had a young girl. She is in her 40s. She was diagnosed with cervical cancer 5 years ago, had total hysterectomy, which is what the treatment is. And it was contained. So they did not do surgery or radiation. They'd sometimes decide to do chemotherapy. Surgery. They did surgery. They did not do chemo radiation. But sometimes if it's invasive, they'll do chemo. And then a lot of times, to make sure they cover everything, they'll do radiation, right? So in her case, it was such early stages. They said it's curative if you have total hysterectomy. And so she's, all good, wonderful. And they tell her she's cured, which is what they tell patients, that you're fine. You don't need to worry about it. Okay. All of a sudden now she goes to the doctor, and she gets, everything's not okay 5 years later.
Yeah. Did she have symptoms?
Yeah, I always ask
appointment?
patients what their first symptom was.
Okay.
And her first symptom was that she had a slight discharge. Okay. So anyway, she goes to the gynecological oncologist. That's a cancer doctor that specializes in female things. So they do a physical exam and they go, oh, yes, you do have a reoccurring nodule in your vagina. Okay. And they go, okay, we better do a PET scan. So they order a PET scan because it'd been 5 years. They better think, okay, well, we'll make sure. So they do a whole body PET scan. The nodule in the uterus, not in the uterus, but in the vaginal cuff, is the vaginal wall is there. And then some things are showing up in her lungs. And so, but they said the lungs are not really an issue. So anyway, doctors say, we can do radiation. We're going to do internal radiation and external radiation. And she goes, no, I don't want to do that. So she comes to see me. And so I always get a very comprehensive story information of your whole life and how you live. And so she's actually pretty health oriented, which is really good. And then I ask her, did you have HPV? Well, yes. And I'm like, okay, well, what did they do? Well, and just so you guys know, in conventional medicine, there is no treatment for HPV, right?
Kind of watch it, right?
You watch it, freeze it, blah, blah, blah. But I have things that I do naturally that help tremendously. So then I did all her blood work, fixed everything on her blood work, had her do EVOX, the whole thing. And so I said, okay, I have this treatment that I am going to use light through a laser. And I'm gonna put on that spot, on that little spot, something called aminolevulinic acid. Well, aminolevulinic acid is something that activates pathological tissue. And then I used laser light inside her vagina. Okay. And we did that 3 times and then repeated her PET scan, all gone. And so her oncologist is like, what? You know, like, I've never seen this. Okay. There was no injury to the patient. Now she's had 2 PET scans. It doesn't show up. The lungs, they tell her it's no big deal. But I told her, everything's a big deal.
Yeah.
Okay.
Right.
Everything's a big deal, guys.
Yes.
Okay. So then I have her doing special nebulized treatments to her lungs that she does at home. She does most of her care.
We love the nebulizer.
Right. So I have her doing special nebulized treatments. She is doing amazing. Okay. And she had no injury. No, do you know what I'm saying? No injury to herself and everything. So, and I always like my patients that, look, I want you to go see an oncologist, to go see what he or she says. Always get their input, 3 heads better than 1. And I want them to know all their options. That is reality. You want to know everything. And so she's doing great. And now we're just going, I'm going to do a new procedure called an SOT. So the SOT is I take the circulating tumor cells and we reverse engineer a new messenger RNA to disrupt the DNA of the cancer cell and the circulating tumor cell. That's given back as an IV, and that IV will last for 4.5 to 5 months killing.
Wow.
Yeah. So she still works. She has no interruption in life. She feels phenomenal because she knows how to do her self-care. Okay. So you see how you can do things we need to think as physicians, how injurious is this going to be and how immunosuppressive is this going to be?
Yeah.
And if we have to do something, what is the collateral corporate of support to take care of the patient while you do something, right? Like if you have to give chemotherapy, because sometimes I have to do chemotherapy.
That was my next question.
To shrink tumor burden. I have to, like if you've got tumors, I have to use chemotherapy to shrink. Now in our clinic, we do fractionated low dose chemotherapy, but you have to sometimes, because sometimes you get big cases, stage 4. I mean, a lot of times I get. So we have to do that. But then what we do is we have all this collateral support so the patient doesn't have down days.
Right.
And so it's a very, very different approach. And so I have so many cases. I have a head and neck guy. He came to me. He lives up in Napa. He was diagnosed with head and neck cancer. He went to Germany because Germany has very progressive integrative treatments like what I do. This was over 10 years ago. And he did 3 weeks of treatment with them. Then he went back and he had the surgery at Stanford for the lump. And then they said, okay, we got to do chemo and radiation. The patient refused. And then they came to see me. Of course, I fixed everything. And then I have been doing the SOT therapy. He's 10 years out, 85 years old.
Wow.
Lives life, plays golf every day, and lives his life every day, full. So there's, and I'm not telling you every single detail, right?
Right.
But I will send you guys, case histories. We've written lots of case histories up because I publish them.
That's so great.
So, but every individual is an original. Okay. Like there's no two people are alike. So I don't like, okay, here we do everyone gets the same thing. No,
Right.
I have to fix you. Okay. Because there's no one like you. So.
Which
Anyway.
is the most important thing to know as a practitioner that a lot of people miss.
Yes.
This has been so good. I could talk to you for hours.
It is fascinating. It is very fun.
Yes.
I invite you guys to come anytime and, be a part of our journey here.
We would
Yes.
love to. We'll get our plane tickets today.
We will be there. So you have 2 books too, right?
Yes,
And
Cancer Revolution and Be Perfectly Healthy. We have great Instagram. I think you guys know Connealy, MD, even though someone tried to take it down on Friday. Well, they did
Back up.
And they finally, through some machinations and connections, fortunately, yesterday we got it back.
Yay.
And so we are up and back and running again. And then we do have the cancer conversation, like I said, every Wednesday. So people can just sign up on the website.
that's great.
And where is that aired?
We do it every Friday. We do it from here on Zoom.
On Zoom. Okay.
Every Wednesday. And so people love it, and we answer questions and we talk about topics. I'll send you last night's just so you guys know.
Yeah, that's so great. Yeah. And then, and did you mention a website?
Cancer Center for Healing. And then if you want to do human optimization and stay healthy, Center for New Medicine.
Okay. All right. Well, thank you so much for coming on. We'll probably have to have you back for a part 2 because we could have gone on for probably another hour with you. It's been amazing.
No, probably 10 hours.
Exactly.
Right?
Yeah, because we can talk about so many other things.
Yes.
Yeah.
For sure.
So anyway, thank you guys for having me, and may you be blessed today.
Well,
Yeah.
give me the biggest hug. Thank you so much.
All right. Thank you guys.
Yep.
Thanks everybody for listening. We hope you guys have a great day.